The eyes are the windows to the soul, or so the saying goes. How to keep our vision tonight on Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. This is our first live program of our 16th season. I'm just as excited about tonight as I was the first program we made 16 years ago. We start this season with a look at eye care. Our vision changes as the years go by, and it's important that we pay attention to these differences. But first, let's take a look at this week's Prairie Doc quiz question. Which of these statements is false? One is false. Number one, a cataract causes your natural lens to become cloudy. Number two, cataract surgery implants a clear lens to replace your cloudy lens. Number three, cataract surgery may restore clarity only, or may restore both reading ability and clarity. Or four, a cataract is a one-act play by a cat masquerading as a pirate. Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of my essays originally written for this show comes with a wonderful accompanying photograph by Dr. Judith Peterson. We'll announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answer in for the quiz, but the whole show to ask questions. We answer your medical questions about how to keep your vision as they're called in or sent to us via Facebook or email. Call in questions to 1-888-376-6225 or send us an email to the address on the screen. Please, this is your show. Call in a question. Joining us tonight from Sioux Falls is Dr. Vance Thompson of Vance Thompson Vision. Thank you very much for joining us, Vance.
Thank you so much for having me.
So you're where are you from originally, Vance?
Gregory, South Dakota.
So you're a Gregory boy,
Yep.
A gorilla. You're
Yep.
a Gregory gorilla.
Yep.
You played football?
Yep.
So is there any problem with vision related to football players?
Oh, well, you know, with traumatic injuries, you want to protect yourself from that, you know, and getting a finger in the eye can sometimes cause blindness.
Yeah.
You really want to protect through things like that, injuries.
All right. So, but the gorilla football team aside, you came from Gregory, and then how did your education evolve?
Went on to the University of South Dakota, got a degree in chemistry, went to medical school there. I interned at Avera, finished my MD, went on to the University of Missouri-Columbia and did my ophthalmology eye surgery residency. And then I did a fellowship in advanced cataract and refractive surgery.
Right there, same University of Missouri.
I did that in Kansas City at Hunkeler Eye Centers.
Oh.
And that's where I did my fellowship. And so I do my fellowship training, my specialty of refractive and cataract surgery. So I operate on the cornea and the lens.
So talk about refractive surgery. That's kind of a fancy word, but you do surgery that corrects, it takes away the need for the glasses.
Right.
Explain that.
Well, refractive surgery is surgery that changes the way the eye focuses light. So if someone's eye has a cornea and a lens that focuses light just right to the back of the retina, the back of the eye, the retina, they don't need glasses. But a lot of people have a cornea that's too curved and focuses too much, so that's nearsightedness, and they're blurry at a distance. Some people have a cornea that's too flat and it doesn't focus enough, and that's farsightedness, better at distance, worse at near. And some people have a football-shaped cornea. That would be astigmatism. And then some people lose their reading ability when their lens gets stiff and they won't see good up close, need readers or bifocals.
Right. But I always thought that most of the focusing ability in the eye was from the lens, and that the cornea was just this clear, you know, window that allows the light to come in and then be focused by the lens. I'm wrong on that, aren't I?
Well, you're very right about the cornea being a front clear protective window, but its curvature literally provides 80% of the focus power of the eye. So the lens provides 20%, but it does something very special.
20%.
20, but it's a variable focus. So the lens can focus up close when we read, or at a distance it gets flat. And so that ability, when we're to see up close, we gradually move things out because that lens is focusing less and less every year until we get in our 40s, our arms are too short.
Yeah.
And we either need readers or bifocals.
Or longer arms.
Right. And that's the first thing that goes wrong with that lens. Second thing is it gets cloudy, and that's a cataract. But the lens is very important for flexible focusing.
Okay, but you said how much is the focus is due to the lens again?
20%.
And 80% is due to the cornea?
Yes. The majority of the focus power is the curvature of the cornea.
Which is the outside part of the eye. I mean,
Right.
Now that's a special thing. I was reading, and I wrote an essay on tears one time. It was amazing to me that tears are not just water or just, they are complex. They've got layers and layers of different things. Tell me about tears.
Well, you know, I like to start out talking about the windshield of our car. When it starts to rain, it's really blurry until you get that windshield going for a while, the wiper going for a while. And that's because the air-tear interface, or the air-rain interface, is where the majority of focusing happens. And the same with our cornea. The air-tear interface is literally the most powerful focusing element of the eye. So if you have dry spots, it can cause tremendous blur, and it's one of the most important things we look for in an eye exam. If someone says I have blurring, but it clears up when or changes with blinks, then we want to do a real good dry eye workup, and there's great treatments.
So I'm starting to get a little bit of that. Part of that is I have glaucoma in one eye, and I've had a bunch of surgeries and so forth. So I find that, you know, I've got to blink a couple times with that left eye because it doesn't kind of, and it seems like there's too many tears. And so now I've learned that there's paradoxes in medicine.
Right.
Sometimes you think it's one thing because it appears to be this, and it's just the opposite.
Right.
Explain the tear story.
Well, you know, sometimes what happens with dry eye people is, and they're tearing too much, they don't believe they have dry eyes. But there's three really important layers to the tear film. There's the outer layer that really is more of a fatty layer to try to prevent evaporation layer of the tear. Then there's the inner watery layer, we call it the aqueous. And then there's the very inner mucin that is kind of sugary. So that three-layer sandwich of tears is very important. And if they're reduced, it sends a message to the brain that the eye's irritated, and it produces too much of the watery component. So it's not the proper consistency of tears.
Oh, so you get a watery tear, but it doesn't have the sugar and it doesn't have the protein.
It takes a good eye exam to tell you if your tearing eye is due to a drainage problem or that you actually have a dry eye that needs to be treated.
Right. Explain the drainage problem.
Well, our eyes, we make tears in various locations, but on the lower lid, there's a drain. We call it a punctum. And on the upper lid, there's a drain. And they drain into our nose, and that's why when we take drops, we sometimes can taste them as they hit our soft palate. And so those drains, we call it the lacrimal system. And actually, the full name is the nasolacrimal system because it's so integrated with our nose. And if there's a plug in that drain from an injury, or sometimes babies are born that way, that drain hasn't quite opened, and we have to go in and open it. But that drainage system is very important to make tears and drain them, so there's a continual flushing.
So it's sort of a river. It's cleansing as it goes through.
Yes.
I mean, it's interesting if you look on embryology. Remember, I remember my embryology teacher, Dr. Moore.
Yes.
Did you have her?
Yes.
Wasn't she wonderful?
Yes, amazing.
So Doc Moore drew pictures of the brain that's developing, you know, as you're in the embryo. And then there's an extension of the brain out. And here are these eyeballs that are an extension of the brain out. And then actually they're the brain.
Right.
And the back of the eye is the sense of light. But it's the brain being exposed to the outer world. There's all these infections out here.
Right.
How in the world are we able to prevent the infections? I mean, what is it the tears that prevents infection? I mean, is it an antibiotic? Is it an I mean, how do we prevent infections
getting to us through the eyes? Well, you know, the tears are very important. There's enzymes in the tears. There's, very important bacterial fighters in the tears. And I tell people the tears, they carry oxygen, they do lubricate, but they also fight for infection. They do a lot of things, kind of like our blood. I call it the blood of the cornea, because there's no blood vessels in the cornea.
Right, it has to get it, it's everything.
Yep.
Oxygen and nutrition from the tears.
Right, yep.
It's amazing. I hadn't thought of that. The blood of the cornea.
Yep, extremely important layer.
So we talked earlier about the dangers of rubbing the eye.
Right.
Talk to me, I mean, people don't understand that, and then we'll get to questions because we've got some coming in, and I really appreciate your questions. Please give us a call. We need to put that number up, 1-888-376-6225. Give us your call. So tell us about rubbing the eye. I had not realized until actually you taught me.
Right.
The dangers of rubbing the eye. What about it?
Well, when I see someone whose vision is changing a lot, or their prescriptions are changing a lot, or they've developed an irregularity in their vision, I'll ask them if they're eye rubbers. Because we live in an environment, especially in rural America, it's so agricultural, and all the pollens that are released, they get these allergies that aren't bothering them so much to go see a doctor, so they'll just rub and they'll itch. And every time you indent that cornea, it can weaken. And it can weaken, and almost like a tire that develops a bulge, the cornea can develop a bulge, and then you need a new cornea or a corneal transplant, all because of eye rubbing. And so I tell people, don't rub your eyes, see your doctor, see an allergist, but learn about the hazards of eye rubbing.
So is there, okay, so I get a scratchy eye, I want to do something. Can I rub a little bit here?
Well, I tell people rubbing skin against bone is okay. That's just going to cause wrinkles. Okay.
Okay.
Yeah, but rubbing skin against eyeball, that's where you need to be gentle. And you don't have to suffer with this itching. You can have it treated, because what it can lead to, even when you're not itching during hay fever season, it can lead to a habit. People go to their eyes and they just itch
They
them.
have habits.
Yes.
They get a habit.
Yep.
So, okay, so I'm going to tell my patient not to rub their eye, but I can give them an eye drop they can buy over the counter. Visine, right?
Well, not necessarily Visine. You want a good eye exam, and you want to have it treated a lot more specifically.
Okay, so don't just go buy an eye drop.
Right.
Go to the eye doctor.
When that one will get the red out, but your eye can start to count on it too much, and actually you can get a rebound redness. So we don't like to chronically use drops like that. A good eye exam and more targeted treatment.
So, but most commonly when people need artificial tears, quote unquote,
right.
Something soothing to the eye instead of rubbing it.
Yep.
What can they buy over the counter that's inexpensive, that's a reasonable, won't hurt them?
Yeah.
Visine can hurt them. I mean, they constrict, dilate, constrict, dilate.
Right. Artificial tears are great, but again, you're not going to find an allergy medication over the counter. You want to get something prescription if you're itchy. If you just feel dry and maybe a little bit itchy, you can try those drops. But as far as preservative drops, you don't want to do those more than 4 or 5 times a day either, because the preservative can start to be an irritant. And so you may want preservative free. So it's really a good idea to have the exam and be educated about what's your best options.
Is there an over-the-counter anti-allergy drop that, that's inexpensive that, might consider? No.
No, I think you really want to have a good eye test.
Okay.
Yep.
We have a question from, I thought we had a question. Okay. A woman from Sioux Falls had cataracts removed, then later had a rapid onset occurrence of cataracts, which was then taken care of at the Vance Thompson Clinic. Was wondering if the doctors could talk a little bit more about what causes rapid onset cataracts. Rapid onset occurrence of cataracts. Why would they occur? That would be the question.
Sounds like she had cataract surgery, and that went well, and then afterwards she developed some blurring. And what can happen is the cataract it sits in a capsule that's as thin as saran wrap, and we'll see cataract surgery here in a little bit, but we removed the front part of that capsule so we can take out the cataract, but that same exact capsule we leave in place to hold the implant to focus for you. Well, the back of that capsule can get cloudy, And that's where we use a laser to open it. So sometimes after cataract surgery, people talk about how they developed kind of the symptoms of cataracts again, but that's very treatable. If they have a cataract that's rapidly growing, so the most common cataracts are age-related. We call it nuclear sclerosis, where it just gets yellower and yellower. But sometimes people, especially if they're on steroids, and it can happen even in younger patients, where they get these little bubbles in our lens, not in the center where the age-related one is, but more in the back, and they can sometimes be rapidly growing.
And it's steroids might cause those?
Yes.
But immune system diseases,
Yep.
lupus,
Yep.
rheumatoid arthritis, those kinds of things.
But healthy people can get them too. So if you have a rapid change in your vision, that's one of the best things that it can be, because you want to make sure it's not a retina or optic nerve or something else. That's why you want to get in for the exam.
And would those people benefit then from removal of their cataract?
Oh, yes. It's one of the most powerful surgeries known to man, and the most common surgery performed in medicine is cataract surgery to improve vision.
Okay. We've got some visuals. We're hoping that this is going to work. And so let's go to our teleprompter and see if we can illustrate what's going on here, Vance.
Well, what we're looking at here is that you're actually in the operating room now. And I'm the person closest to you, and then you see my assistant right next to me, and I'm looking in the microscope. You can see the microscope there that I'm looking at, and then down here you see the actual cornea, and we're going to be operating on that, and we're going to be going inside that eye. And basically what happens with that surgery is we make an incision in the outside part of the eye, right about there, and we're going to go ahead and do that so that we can get access to the inner eye. And then after we get access, and we be sure and make that cornea, keep it nice and moist while we're operating on it. And then after we get access to the eye, then we go inside the eye. And with this device we're doing right now, this is actually called the Zepto technology, and this is going to help us get access to that lens, and it's almost like a cookie cutter. It makes a perfectly round opening, and then once you go ahead and you discharge it, this makes us so we can get to the cataract, and then we take it out with actual ultrasound, and we remove the lens. And then it's time to do the implant. And this shows the implant. If we want to watch the actual implant going in, we've just made the capsulotomy, or that nice circular opening in the capsule with the cookie cutter. And now we're using the ultrasound to remove the cataract. And then now we've cleaned out the capsule and we've made a home for the implant. And the implant's going in right now. It's made out of acrylic or silicone. We can put them in 2-year-olds and we can put them in 90-year-olds. This material lasts forever, and then it unfolds and then it's in the eye. And that is what refocuses light for you after cataract surgery.
So I always thought that those implants were rigid.
Right.
But they're not. I mean, they're tiny little things, and then they just expand once they get in an open space.
But you're right. That's how they started out, as rigid. So you had to put them in through a larger incision. And you remember the days when they talked about you had to be in the hospital for 2-3 weeks and sandbags, and how cataract surgery used to be such a long healing period. It was because of large incisions. And as we got smaller and smaller and smaller, and then when we were able to fold it and put it through a micro incision, recovery has become so, most people are back to work the next day.
Oh, yeah, wow, that's right. I mean,
I talked to one of my patients coming up here. I like to call my patients after surgery, and he was already doing some phone calls and work with his office, and he had cataract surgery 4 hours ago.
wow, that's fabulous.
Yeah.
Oh, we got questions coming rolling in. A woman from Winter would like to know how long it takes to heal an infection in the eye. Now, so let's talk about infections. We did introduce that question.
Right. Well, it depends on where the infection is. You know, if we work from the front back, if it happens in the cornea, For instance, if there's a contact lens related
Right.
ulcer or something like that, that's why we tell people if you're having redness or drainage, get in right away. Don't let it become a big infection that's going to cause a bad scar and hurt your vision. We typically can get those infections cleared up in a couple weeks, but it's a very important couple weeks. If it's an infection inside the eye, that becomes extremely serious, and that can cause blindness. And that's why we tell people, if you're having eye pain, especially after surgery or decreasing vision, get in right away. There are treatments for it, though.
Right. The most common eye infection I see is just your common pink eye.
Conjunctivitis.
Yeah.
We call it conjunctivitis.
Conjunctivitis.
Yeah.
Little kids come in with a pink eye. They get an antibiotic as a rule, and then they are back to school the next day because they've got the antibiotic. I was taught, I think, at Emory that 80% of the time those are viral and they're not important. I read maybe 2 years ago that 80% are not viral, they're bacterial, but they're self-limited, they're generally not a problem, but we do the antibiotic to prevent spread so that when they go back to school. Would you agree with all those comments?
Yeah, I would. And we do have ways to tell between viral and bacterial now, too.
Oh, we do?
So we can do testing where we test, we actually get material, get tear film material or mucus, and then we test it to see whether it's viral or bacterial.
Yeah, it's amazing. Most of that is self-limited. Your body defends yourself against it.
Right, exactly. Yep.
And of course, we're recommending people come in to get an antibiotic eye drop, even though we are trying to not overprescribe antibiotics, but we're trying to prevent spread of those bacteria to the other kids in the daycare. Or you have any other recommendations?
Well, we're looking a lot at the drainage too. If it's clear, typically it's viral or allergic. If it's cloudy, then we're starting to worry about either bacterial or secondary bacterial after a viral infection.
Mm-hmm. So the other issue is how much of that pink eye is related to little kids rubbing?
Right. Well, and then, not washing their hands and touching something else, and then the next person gets it. And so it's that, hand to other things contact that really can spread it.
So one more reason to wash your hands.
Right, and not rub your eyes.
And not rub your
Yes.
eyes. So I mean, if I say, hello, Vance, nice to see you.
Right.
Now, you might have just blown your nose. I have no idea what you've done with that right hand in the last hour or so.
Right.
And then I go, well, and then well, I just took everything that you had on your hands and put it in my eye, which if it's a cold, I can give myself a viral respiratory infection.
Right. And that's why...
Or meningitis.
That's why hand washing or using antiseptics and rubbing that lotion is so important to prevent so many diseases.
So on the other hand, they say that we live in this too clean of a world. There's that hygiene theory, of allergies and so on and so forth. Anything that's related, I mean, I'm totally in belief of washing your hands, but any comments about maybe it's good to have some infection so we have resistance?
Well, I do believe in exposing ourselves to the environment so that we do develop a good immune system. And so common sense goes a long ways, though.
Yeah. Common sense. Okay, I'm back to the woman from Aberdeen would like to know what causes double vision after cataract surgery.
Well, sometimes you can have a little double vision because you had a large correction. You kind of had thick glasses. And usually what's nice about cataract surgery is you can get to, if you want, no glasses or thin glasses. But that couple weeks in between with thin or no glasses and a thick lens can really cause double vision. That's one of the more common causes. Sometimes, dryness or something can cause some doubling. If someone, most cataract surgery doesn't need a shot to do it, usually just numbing drops. But if there was any reason that a shot needed to be done, that can limit eye movement for a few hours after cataract surgery and cause double vision.
So your eye's doing this, the other eye's moving around the room,
Right.
but this one's staying still.
But most people don't need that anymore. In the old days, that was done a lot.
Okay. A woman from Madison wonders if you could speak to a new cataract surgery technique that would make surgery safer.
Well, I love the questions coming from all over. We talk about laser cataract surgery. And we feel like some of these advancements in cataract surgery have become very important. One is how we calculate the implant power. That's made it more accurate, but also how we perform the surgery. And then the antibiotics that are being used these days have made it a lot safer. The small incisions have been absolutely revolutionary in increasing the safety of the procedure too. And then, not to sound too complicated, but what we call the fluidics, the fluid going in the eye, making it a nice balanced pressure the whole time. So there's not lots of fluctuations that can increase the risk of retinal detachment or something like that. Okay. There's some very sophisticated things that have been done to make it safer.
You told me, as long as we're talking about developments of new surgical techniques and so on, that as try as you might make that lens perfect, but it's not going to be perfect every time.
Right.
But you have now the possibility coming up of a lens that you can put ultraviolet light in. It will change the amount of correction that lens will do. What's that story?
So exciting. So, having been involved with my team and my partners in the development of LASIK and some of the research we've done in advanced technology has taken us all around the world. But one of the most amazing technologies we've been asked to help develop is a lens implant that comes from the company 80% polymerized, but not fully polymerized, meaning it's still in an adjustable state where you can change its power. You do your normal cataract surgery, put in the implant that typically you would never change the power because they all come 100% polymerized. And then 3 weeks after surgery, rather than glasses or anything else, you measure what the need is for their vision, and you can use an ultraviolet light to adjust its power in the eye, the first truly customizable implant to that patient. And when they say, yes, that's where I want my vision, you lock it in. It's not FDA approved yet. We've been a part of the FDA research, and it's been very exciting, and we're hoping that it would be FDA approved in the near future.
Doesn't look like there's a downside to it?
No.
Cost, maybe it would be.
Yes, these technologies can get expensive, yes.
Yeah. Woman from Huron wonders, what is Fuchs corneal dystrophy? Let's talk about Fuchs.
Right.
Corneal dystrophy. We got about 60 seconds.
The eye is so fascinating. The back of the cornea, the back of our front window, if you look at it under a microscope, looks like a honeycomb. Those little honeycombs, each cell is a water pump, pumps the water out of your cornea into your eye to keep that window clear. People can lose those cells. And Dr. Fuchs...
For any reason?
Well, it's usually passed on in an autosomal dominant, so genetic fashion. Happens a little more frequently in ladies. And so what happens if you lose some water pumps, your cornea swells. And if you lose enough, then we can replace them.
So you need to replace, so what they're doing now is they're replacing the inside cornea.
Yeah, it used to be you had to have a full thickness corneal transplant, lots of recovery. Now you can take that little, 20 to 50 micron layer and replace just that, thinner than a human hair.
So you get a corneal transplant, you slice it into a very thin little deal, and then you put it in there and then blow it up, a bubble or something.
Yes. Roll it up like a little burrito, and you slide it
burrito.
in, and it unfolds. You put a little air bubble, and it just is amazing. So.
Wow, Fuchs dystrophy. Women, let's roll into this. Most of us have heard of the seafood diet. We see food and we eat it. Well, there are foods, though, that give us the nutrients that help us to maintain our ability to see.
When trying to improve your nutrition for eye health, you want to remember your ABCs. Vitamin A will help with dry eyes and also fighting eye infections. Foods high in vitamin A include eggs, milk, and liver. B stands for beta-carotene. Beta-carotene will help prevent macular degeneration. Foods high in beta-carotene include orange vegetables such as squash, sweet potatoes, carrots, and spinach. C stands for vitamin C. Vitamin C will help prevent cataracts. Foods that are high in vitamin C include citrus fruits, broccoli, peppers, and also strawberries. You also want to remember your L's and your O's. Lutein is helpful in protecting your eyes from sunlight damage, and this is found in many foods such as kale, leafy greens, peas, corn, kiwi, mangoes, and honeydew. And also omega-3 fats are helpful in preventing dry eyes. These are found in fish, walnuts, flax seeds, and also olive oil.
Well, we're back with more questions, Vance.
Yes.
Let's get right into these. We're getting great questions. Thank you so much. A woman from Arlington would like to know if you can have LASIK after, it's LASIK. See, that's not Lasix, the diuretic.
Right.
But it's LASIK, which stands for?
Laser-assisted in situ keratomileusis.
Okay, so I'll just remember LASIK. After cataract surgery. Can have LASIK after cataract surgery or after detached retina?
Well, you can have it after either. The best candidates are the people who see good with glasses, and they want to see good without them. And so if they're not seeing good with them because the retinal detachment repair or something didn't work so good, the LASIK is not going to do it either.
So if you can see well with glasses.
If you can see well with glasses, we can help you see good without them.
All right. Then we've got a question from T. Had cataract surgery 2 years ago on both eyes, has glaucoma as well. I think there's a relationship there,
Yes.
isn't there? There's a higher risk of glaucoma after cataract surgery.
Well, actually, cataract surgery is felt to be a good treatment for glaucoma.
Oh.
Because what happens, the cataract sits behind our iris and pushes it forward, and it can start to crowd the angle where the fluid drains.
Right.
And you do cataract surgery, and the iris lays back and opens the angle. And so it's one of the most important treatments for glaucoma.
Oh, so I stand corrected
Yeah.
on that one. He still cannot see well, even with his glasses. He is wondering if there might be something wrong with his prescription, or did the surgery just not work, or should he go in for an eye exam? Cataracts 2 years ago, can't see well with glasses.
Well, I'm impressed with his suggestions of answers, and the most important one is to go in for the eye exam, because I bet there's some neat things that can happen to help him. What you don't want to have happen in glaucoma is have it steal your vision, because it takes the peripheral vision first, and it's painless. And by the time you notice that your vision's blurry from glaucoma,
You've already lost 3/4 of it.
you've lost so much of it. And that's why, if it's under control, you definitely want to go in and see if there's other reasons, but a good eye exam.
You know, this whole story of glaucoma, it's the silent blind causer.
Yes, and it's just, it's the most common reason we tell people to go in for an eye exam. Same with our general health, to get your blood pressure checked. With your eye health, get your eye pressure checked. Before the age of 40, every 2-3 years. After the age of 40, every year.
Okay, after 40 every year. And then all of a sudden, this went away from me. Here is a man from Sioux Falls suffers from blocked oil ducts and is wondering what causes this and what can he do.
Right. You know, this can be a really
Oil ducts is
disturbing problem. You remember how I was saying that the tear film has 3 layers, and that outer layer is the fatty layer that helps prevent evaporation of the tears? It's the oil glands in the eyelids that make that. And so the people that have this problem, when the vent goes on in their car, they feel like their eyes are super irritated.
Right.
Any wind currents, super irritated.
Yeah.
And there's great treatments to open those oil glands.
Oh, really?
Oh, yeah.
But now, and sometimes the oil glands get infected. You get these
Yep.
meibomian cysts. And
Sometimes they need to be drained, but most
Schillings.
commonly it's just a generalized blockage that can be treated.
how do you treat it?
Well, warming it up is the best way. And we can use a technology that warms it and then compresses and squeezes it out like almost like toothpaste to get those ducts opening
Open up.
and flowing.
Yeah, because they get thick and plugged.
Yes.
Okay. A caller from Watertown, and it isn't a caller, it's a Facebook question. So we're thank you for a Facebook question. A Facebook question from Watertown wanted you to discuss the difference between kinds of cataracts: nuclear sclerosis, post-subcapsular cataract,
Yeah, so the center of the lens, so the lens sits right behind our pupil, the center we call the nucleus, and that's the one we're born with, the fetal nucleus.
Right.
And that's the one where age-related cataracts most commonly happen, and we call that nuclear sclerosis, or center hardening and getting yellow. The front of the lens we call anterior, the back we call posterior.
Right.
And if it's under that capsule, we call it posterior subcapsular, anterior subcapsular. And then the final one I think about is the spokes in a wheel. We call it like cortical cataracts.
Okay, and any particular reason for any one of those, or any and all can happen randomly, or what?
Usually the nuclear ones are related to aging, but sometimes the cortical or the subcapsular are related to nutrient issues, or sometimes steroid or medication use or certain illnesses, but they're all equally treatable with surgery.
Okay. A woman from Sioux Falls has autoimmune retinopathy, is wondering what can be done. So autoimmune meaning rheumatoid arthritis, one of those kind of weird kinds of autoimmune where
Lupus.
lupus is a good example, where your immune system is turning against your body and apparently can do something against your retina.
Right. And there are definitely treatments for it. Sometimes they're challenging treatments, and we're oftentimes referring to centers who see higher volumes because they're not super common, but they are treatable.
Okay, and I suppose part of the treatment is to get a handle on the autoimmune disease.
To treat your whole body. That's
Right.
exactly right.
But oftentimes, at least it used to be, there were steroids involved, and steroids can sometimes be part of the problem for eye disease as well.
Right, right.
What are
Cataracts.
what are they? Mostly cataracts?
Mostly cataracts. Now the liquid, the topical, the drop form of steroids can increase eye pressure. That's one of the reasons we don't like using them chronically, or if we need to
Long-term wise?
to use them long term. If it's a corneal transplant that needs it, then it should be under a doctor, care, and they're checking your eye pressure, because steroid drops can raise your eye pressure and cause glaucoma.
Yeah. That's what I had. I had glaucoma as a result of steroid drops.
Okay.
A man from Sioux Falls would like to know what would cause a fibrous type of skin tissue in the vitreous fluid of the eye. Is it concerning? So now there is apparently the vitreous, which is that big ball, that big sack of fluid that's
Right.
behind the cataract or
Right.
the lens and in front of the retina.
Right.
Now that big sack of fluid has shadows of scar tissue in it. That's
Well,
what his concern is.
We call it the vitreous gel, and so it fills the inner eye. And as we get older, after the age of 21, it starts to turn from gel to more liquid. And that vitreous attaches to the retina. And as it gets to a certain amount of liquidness, it can collapse upon itself and separate from the retina. Way different than a retinal detachment. We call it a vitreous detachment. But its little attachments that separated from the retina can have that kind of fibrous tissue, create tremendous floaters. That's why we tell people with floaters or flashes of light from the vitreous separating, almost electrical phenomenon, to get in and get it checked out, because you don't know if it's the benign or the not worrisome vitreous separation, or did it tug off a piece of retina that can be lasered to prevent a retinal detachment?
Right. So, I mean, when you're seeing floaters, you need to have it checked. But most of the time they'll leave the floaters as long as there isn't any danger. Just they'll say,
Right.
the floaters are there, but don't worry. Good.
They can be removed. They can be lasered. But usually we say, see what time does, because the majority don't need anything.
Okay. A woman from Sioux Falls would like to know about macular pucker and treatment options. How advisable is surgery? So I haven't heard of macular pucker.
Right. Well, the inside of the retina is covered by a membrane that is as thin as saran wrap. We call it the internal limiting membrane, and it kind of covers the rods and the cones. And what can happen is it can crinkle upon itself. We actually call it cellophane retinopathy, or we call it an epi, or on top of the retina, epiretinal membrane. And when it crinkles enough and distorts those rods and cones, it causes blur. And the retina specialist can peel that off and have the proper orientation of the rods and cones and improve the vision.
All right. So
Very
it's
successful surgery.
Peel type
Yes,
of a thing.
exactly.
So let's talk about macular degeneration a little bit. What are the different kinds of macular degeneration? We had a question about that.
Yeah, we basically put it into the dry form that's, typically 85 to 90% of it, and the wet form, which is, a smaller percentage, that 10 to 15%. The dry form is really just kind of a thinning, age-related change in the sharp area vision that we call the macula.
The center, the
Yep.
central vision.
You don't go blind, lights out from macular degeneration, because it really just involves the center, and the outside is okay, but the center can get very blurry. And so, but there are ways to slow that down. That's why get the eye exam and get on the sort of medications and diet that help slow it. The wet form that can really change the vision rapidly, that's what we want to look at, as far as you can inject medications to lessen it, because these new blood vessels that grow in the wet form can hemorrhage and cause tremendous reduction in vision.
All right. And so some of that, though, is irreversible.
Some of it's irreversible. That's why you want to get good care and lessen the progression.
I've heard that that smoking is one of the major reasons that macular degeneration and cataracts occur. Do you agree with that?
I do. That's why you want to, watch your blood pressure, watch your overall cardiovascular health, and get good examinations.
And go for a walk every day.
Yep.
So we have a woman from, I'm trying to get back to a woman from Sioux Falls has a bloody eye from broken vessel, and it's lasted a few days. Is this a cause for concern?
Typically, this can be caused either from bumping it while you sleep. Sometimes, sneezing or weightlifting, lifting heavy things can cause it. We call it a subconjunctival hemorrhage. Usually not worrisome. If it happens again, we usually suggest that they be examined. Sometimes we'll check to make sure there's no clotting problem, but usually they're painless and don't affect vision. If there's any pain or affects vision, get checked right away.
Right. But I've as a care provider for many people who are diabetic or vascular disease or heart attacks in the past or previous strokes or any kind of vascular problems that I see potential problems, I have them on baby aspirin.
Right.
And then they'll end up with a bright red eye.
Yeah.
And it'll go up to the iris, but it'll stop. There's no pain.
Right.
There's no vision loss.
Right.
And it goes away. I ignore
Right.
it. I say, don't worry about it.
Yeah,
Right?
very dramatic, but not going to hurt your eye.
Okay. How about, here's a woman from West River calls with concerns about her husband who has squamous cell cancer of the cornea. I haven't heard of that. I mean, I knew that it could occur, but I just haven't.
Yep.
Caused by the sun. He had surgery, but it couldn't all be removed. Is this disease extremely dangerous? Is it treatable? He also has eye drops that act as chemotherapy. Is that what you would recommend?
Definitely. So, since we live in the Midwest where there's a lot of time outdoors, the ultraviolet rays can affect the conjunctiva, the lining of the eye, and you can develop a bump just on the inside aspect of the, not too far from the nose. And people come in and they're called a pinguecula. When they grow on the cornea, we call it a pterygium. But every now and then one can turn malignant. And that's where it would be what we would call a neoplasia, or a squamous cell carcinoma is the most common one. And you can actually treat those with chemotherapeutic agents.
So I had tons of people who'd come in with pterygiums. Tell me what a pterygium is. It looks like a tumor.
Yeah.
And when do I need to know that it's okay, or when do I need to do something about it?
So when our conjunctiva gets activated by the ultraviolet light and develops that reaction that starts out as those bumps, when they start to grow on your cornea, that's called a pterygium. They don't need to automatically be removed. As a matter of fact, we're somewhat selective about removal because they can sometimes recur more aggressively after you remove them. So when we do remove them is when they're growing and getting close to the pupil. We don't wait till they're causing blur, because where you remove it from, there is going to be a scar. So we're monitoring it, and as it's getting closer to the pupil and it looks like it's going to be an issue, we can remove it.
Okay. A woman from Huron wants to know if cucumbers help for tired eyes. You see all these people with cucumbers on their face. In fact, I want a periorbital irritation occurs, but in another patient, so we'll get back to it. But the cucumbers for tired eyes, had cataract surgery, detached retina, wants to know if that's a common combination, and should she continue the cucumbers?
I love cucumbers. I would eat them, and I would use something else for the moist coolness. There's very nice ice packs that have been developed specifically for the eyes. If you want to use, put your cucumber in the fridge and then cut it up and take that cool thing and it feels good, you're not going to hurt anything, but it's nothing different than the moisture and the coolness.
So a cool pack is what we're looking for, and eat the cucumbers because it has good things in it.
Yes, not too much salt, little pepper.
Okay, so a little vinegar. I like a little vinegar on my cucumber. So I had a patient, actually it was the mother of a person that I met yesterday who asked me about this terrible redness that her mother developed over the last 3 months, and she'd been to a bunch of doctors and no help. It seems to be getting worse. The patient seems to have some kind of internal malignancy. Worries me that has something to do with it. There's all sorts of treatments that they're putting on it, which makes me worry that one of the treatments she's allergic to.
Right.
So it's just this red derm all around the eye. Do you have any clues or suggestions?
Sometimes it can. The tears can become an irritant, and so sometimes, looking at that real good and seeing if there's any creams that are being used, or we've always asked if they've changed detergents, if there's a contact dermatitis or something like that. We get the dermatologist.
Worry about that.
Yeah, we get the dermatologist involved.
Yeah.
But typically we can figure things like that out. Every now and then you get what's called paraneoplastic syndromes, where it just happens along with a patient who's undergoing that type of therapy. But that's a diagnosis of what we call exclusion.
Right. There's a man from T who would like to know, this is asking am I done with my treatments? What's the outlook of the show, and will you keep the viewers up to date on this progress? And I'll just say that I had the Whipple procedure May 10th, right after the last show that we did of the season. And this procedure generally causes weight loss. I lost 25 pounds. I've been stable for a month. I'll find out whether there's any evidence of recurrence in a couple, 3 weeks or so. My sense is that if there is recurrence, it's going to be quite a while.
Right.
If there is not, then I have a 50-50 shot of a cure. So I'm kind of positive about that. I'm not having any more treatments, and I have made every effort to have backup doctors to be the hosts to replace me if I'm not around. And I've got the schedule set for this whole next season. I'm planning on getting work on the next season after that. So I'm not planning on this show ever ending. It should last way past Rick Holm. We are trying to bring good news of science-based, evidence-proven data in a world of misinformation to you, and I don't want it to end for you. So, and I have to say that we do this with volunteer doctors, except I paid you a great deal to come up here. How much did I pay you, Vance?
You paid me $0, and it's so good to see you. And you look great. It's an honor to be here with you.
Well, it's an honor that you would come, and I'm glad you're here. Join us online. We've got more information about that issue and more online. And now for the winner of tonight's Prairie Doc quiz question. Which of these statements is false? I have to tell you, I got this quiz question from Vance Thompson himself, who has a sense of humor. Number 1, cataract causes your natural lens to become cloudy. Cataract surgery implants a clear lens to replace your cloudy lens. That sounds pretty good too, doesn't it?
Yeah.
Cataract surgery may restore clarity only, or may restore both reading ability and clarity. I think that sounds pretty good. A cataract is a one-act play by a cat masquerading as a pirate. I think you made that up. And the answer is 4, cataract. That's pretty bad. It was Gary Newberger from Willow Lake who answered the question correctly. Thank you, Gary, for participating, and a book will be in the mail to you soon. We'll be right back after this.
All around town, from stores to playgrounds, babies are on the move. And there are diseases that are on the move too, and some of these spread easily. To best protect him from 14 serious diseases by the time he turns 2 years old, vaccinate him according to the recommended schedule, so he can go on about his business and you can have peace of mind. For more reasons to vaccinate, talk to your child's doctor or go to cdc.gov/vaccines.
My father was in his 50s when his retina, the lining which provides a blanket of vision on the inside back of one of his eyes, started separating from its base structure. Called a detached retina, this condition occurs in 3 people out of 1,000, more often in men, in certain families, in those with nearsightedness, in obese hypertensives, and in those who've had cataract surgery. Dad's first symptoms included floaters, quick flashes of bright light, and blurred vision starting in the peripheral part of his vision and gradually moving toward his central vision like a gray veil falling across his line of sight. There was no pain with this. However, he became understandably fearful as his vision deteriorated. I remember his having open eye surgery at a university center in Minneapolis, which was cutting-edge treatment at the time. It required 2 weeks of hospitalization after surgery with both eyes patched closed and with absolutely no head motion while sandbags pushed against both sides of his head. His constant companion and only entertainment was a radio plugged into his ears. I remember when he finally came home, he was overjoyed to see us, seemed to have a renewed appreciation of life, and was happy that his vision seemed to be gradually returning. That was the late 60s, and I don't think his appreciation for life ever waned after that. Modern treatment for detached retina may include reattachment of the retina with laser beams like spot welding, or freezing small areas, cryotherapy. Sometimes the walls are squeezed together by a band the surgeon wraps around the sphere of the eyeball. In other cases, the vitreous jelly, or the bag of fluid that fills the eyeball, is removed, and the fluid is replaced with a gas bubble to push the retina back into place. Each case is different, and the treatment approach may vary depending on severity and type of detachment. Fortunately, modern-day treatment for detached retina no longer requires 2 weeks of eye patches and sandbags holding the head perfectly still. Big thank you to our guest, Vance Thompson. Though the summer is coming to an end, thank you, Vance.
Yes, thank you.
We are at the time when West Nile infections are often the greatest so far this year. 39 cases of West Nile virus disease have been reported to the South Dakota Department of Health. 33% of cases have neuroinvasive disease. 67% have West Nile fever. 44% hospitalized. No deaths this year. Highest level in the 40 to 64-year-olds. Use bug repellent with DEET. West Nile can cause very serious infections. Well, that does it for tonight from all of us here at On Call with the Prairie Doc. Until next time, you have to remember, you can watch the rest of the questions. We got tons more. Go to Facebook, On Call, Prairie Doc, search Prairie Doc Facebook, and you'll find us there live right now after this show. So until next time, stay healthy out there, people. Thank you, Vance.
Thank you so much.
The skin is the protective wall between us and that dangerous world out there. Scratches, sores, and bumps on the skin. Next time, On Call with the Prairie Doc. Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. And with the ongoing support of these individuals and institutions, Brookings Health System, Ophthalmology Limited, Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision, Aberdeen District Medical Society, Black Hills Medical Society, Dakota Bank, Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, and Swiftel Communications.